And now we have a panel before our break. Some might be itching for a break right about now, but we're thrilled to have this distinguished panel moving to the stage now. Our next panel is titled Home and Community Living for All, Insights from State Leaders, and we'll focus on the topics of employment, workforce, behavioral health, and social services. And I will would you like me to introduce, or would you like to?
Go for it. Yes,
Okay.
it's on you.
We have 4 distinguished panelists here, starting at the your left, my right. We will be moderated by Dr. Darcy Delgado, Assistant Secretary with the California Health and Human Services Agency. Next to Darcy is Abby Snee, Deputy Secretary of Workforce Strategy with the California Labor and Workforce Development Agency. To her left is Elizabeth Landsberg, Director of the Department of Healthcare Access and Information. And right here to my right, we have Claire Ramsey, Chief Deputy Director for Disability, Adults, and Housing Integration with the California Department of Social Services.
Thank you, Director DeMorris. It's so great to see everyone. Darcy Delgado, Assistant Secretary. Just so folks know, 2:55, we're going to break. We are not going to run over. We are going to be on time so that we can get what I hope are cookies and maybe some coffee for those of us who need caffeine, which would be me. It is so great to be here. I just want to praise the Department of Aging for your staff and all of this work today, because after having worked at Health and Human Services Agency for a while, there are very few departments that put on entire conferences where it is your job as stakeholders to tell the state policy folks what we need to do. The engagement with stakeholders that Department of Aging has is unparalleled. So just kudos to your team for all the great work. And so I've got my prepared questions. I'll look at my paper in a second. But really, my hope for all of the stakeholders out there is that you get to know these 3 fabulous women next to me, because they oversee, along with their teams, a significant amount of funding that goes to the work that you all do every single day. We are up here, trying to help make the best policy decisions possible, but you all are in the trenches actually doing the work. And it is our job as policy folks to make sure that we get the funding to you so that you can do that amazing work. And so while I will get to my prepared questions, I hope that you all get to know Abby, Elizabeth, and Claire, because their teams really need you as much as you need them. In fact, we need you more than you need us. So please, as we're talking today, panel, again, should have prepped you, if you could talk a little bit about also what the funding opportunities are associated with the comments that you're going to be making. And if nothing else, just get used to their faces so that during the break you can come ask them lots of questions. After today, you can ask for meetings with folks to really better understand how you can take advantages of the funding opportunities. Now we'll go to script. So we're talking about home and community living for all. And so what we're going to do is I'm going to start with one question for each, and then depending on where we are with the 2:55 deadline, maybe one question for the full group. So we'll start with Deputy Secretary Snee. Sorry, translator, I will slow down. I'm a little fast in speaking. So Abby, Deputy Secretary Snee, you have throughout your career really focused on increasing economic mobility for immigrants, refugees, and really trying to take the healthcare workforce to the next level. Right now, your work with the Labor, Workforce and Development Agency, along with Secretary Knox, your team is very focused on a number of different efforts that impact the Master Plan on Aging and really the workforce that we've been talking about and hearing about today. So would love, make sure I asked you the right question. Would love to just hear a little bit about where you began, kind of how that has helped frame and inspire the work that you're doing today along with the rest of the folks in your agency.
Sure. First of all, thank you for this incredible conference. I am learning so much here today, and thank you for the opportunity to be on this panel with 3 of the women in state government I love working with and am most inspired by. But as an older worker myself, I will be brief and not go through everything, but I started out there's a clear trajectory for me. I started out in public education as a high school English teacher and then a middle school counselor, and I've really spent my entire career at the intersection of education and workforce. First, 40 years at Jewish Vocational Service in the Bay Area, building training and education programs that moved people from underserved communities to self-sufficiency, and then have really had the honor to move to the state level at the labor agency, working at far greater scale to build equity and impact into our public workforce systems and create partnerships and programs that open doors to good jobs and career pathways to good jobs for people in our communities who've been left behind.
Awesome. Thank you so much. Okay, moving on. I kind of feel like what was the name of the dating game where it was like contestant number 2? What was that? The dating game. Okay, there we go. There we go. Okay, Director Elizabeth Landsberg is next. If you all have not met Director Landsberg, she works with the Department of Healthcare Access and Information, formerly known as OSHPD, for those of you who have been around a while. And Director Landsberg's team is charged with really trying to tackle the healthcare workforce. She's going to be talking a little bit today about some of the just important health workforce initiatives that her team has been tackling, but don't want to steal her thunder, but talk a little bit maybe about community health workers, promotores, the Healthcare Workforce Education and Training Council, and if you don't know much about it, please learn a little bit about it so you might be able to tap into this funding opportunity. But the Behavioral Health Services Act that was associated with Proposition 1 that passed in the last election. So Director Landsberg, just would love to hear a little bit, kind of similar to Abby's response, kind of where your career began and how that helps formulate the work that you do in the space of older Californians and Californians with disabilities.
Thanks very much, Darcy, and it's really great to be here. The lights are shining in our eyes, so we can't see you very well, but I know you're out there. I can see some of you, and it's wonderful to be in the room. In terms of my career trajectory and what inspires me, I've been in health policy work for 24 years and just love it. I sort of fell into it and now can't imagine doing anything but health policy. If you're a local advocate, who are the local advocates in the room? I started my health policy career at Legal Services of Northern California, as a supervising attorney working directly with healthcare consumers, and I'm so glad I started my career that way, understanding the barriers that consumers face in accessing healthcare services. Seniors, dual eligibles. I will never forget the dual eligible I talked to who was trying to figure out Medicare, Medi-Cal, Medicaid, and what covered what and how did it all work together. And she's like, and why do all the names sound the same? Why don't they? And I was like, yeah, 49 other states call it Medicaid. We had to come up with a cute name, Medi-Cal, but Medi-Cal is Medicaid. So we don't make it easy for consumers. So for all of you who are helping individual consumers and seniors navigate what is so complicated, thank you so much. If you work in statewide healthcare policy, I'm with you. For over a decade, I was at the Western Center on Law and Poverty, advocating for the needs of low-income consumers. Share of cost is a really big issue, near and dear to my heart. And after 16 years of kind of working on the outside, advocating to state government to do things, I thought, well, maybe I should try coming inside and making a difference from the inside. So I've been in state government for 8 years. It's been a really rewarding experience to see what we're able to do from the inside, but the consumers and the issues that I worked on as an outside advocate, as a consumer-focused advocate, really stay with me. So I'm inspired to work for this administration that centers equity. So it is wonderful to work for a governor who issues executive orders telling us we have to focus on equity, which we want to be doing. It was wonderful to serve under Secretary Mark Galley, and we are thrilled to have Secretary Kim Johnson. So you see the kind of leaders who are really setting our North Star, and we are able to do so much within state government. I think California has had great success in expanding health coverage, and now we really need to be focusing on access, right? So at HCI, we have an Office of Healthcare Affordability. We're focusing on trying to help healthcare be more affordable. We are, what I'm focusing on today at this conference is about developing the healthcare workforce that California needs. A culturally competent workforce that better reflects California's diversity, because we know we get better health outcomes. And so it inspires me so much to be part of an administration that has those values. And I don't know if I'm supposed to start talking about our services or
It's
just...
okay. Why don't we go to Claire, and then we'll come
Okay.
back to talk about maybe like your top 1 or 2 initiative
Great.
work streams you want to talk about. Okay, so Chief Deputy Director Ramsey. So Claire Ramsey works for the California Department of Social Services and oversees and works with many of the same topics that we've heard about from stakeholders today, including the community care expansion that helps build and rehabilitate community care facilities, Home Safe, Project Home Key, Adult Protective Services expansion, just a lot of really important services that CDSS provides. So if you could give us a little bit of your background, Claire, and what brings you to this space.
Yeah, thank you. So happy to be here with all of you today. And kind of like Director Landsberg, my start is with legal services. And I worked as a legal services attorney for almost 15 years before coming to the state. And the theme that I really see throughout my career is a real focus actually on disability. And that started kind of early when I was working on childcare at Child Care Law Center and really working on access for infants and toddlers and then for children with disabilities. And really to the point, looking at what could the state do more of, better, differently, with more emphasis to really make childcare work for families, especially low-income families who have such trouble affording it. And then after working for a number of years at Child Care Law Center, I moved to working at Legal Aid Society of San Mateo County. And that really gave me a wonderful opportunity to do direct services with older adults. So at that job, I really worked on Medi-Cal, on IHSS, on CalFresh, and really got to see, and on SSI and Social Security, and then also on elder abuse restraining orders. And so some of what we heard earlier today were, we heard about the challenges people have in accessing the legal services they need. It feels very near and dear to my heart because it's such important work, but as you can imagine, it is really hard to get enough people to serve the needs. So that work was really impactful and really guided my career because after working there, I moved on to Justice and Aging. And I have many of my former colleagues here today, and you heard from many of them today. And that really allowed me to really delve in on some of the policies that I was seeing while I was a direct services attorney that were not working for people. And to really start to say, what are the systemic level solutions to these individual challenges? Like a perfect example, we talked about sheriff costs, but we also talked about, Medi-Cal eligibility, seeing people challenged by the Medi-Cal asset limit, right? And the story that always sticks with me was a client who had become ineligible for SSI and Medi-Cal because she was saving up for 2 hearing aids and she had $2,500 in her bank account, and it pushed her over the edge. So then she's lost income and health insurance because of something she needed to access the world, to make sure she had the accessibility she needed so that she could have her hearing aids. So that really informed the work I was doing at Justice and Aging, working on Medi-Cal eligibility to expand access for older adults and people with disabilities, to really look at IHSS and how we can continue to make sure that program is working for the hundreds of thousands of people it's serving throughout California, and then really working on the master plan for aging itself. So with many of you, I was on one of the subcommittees, this one, the Long-Term Services and Support Subcommittee, and I think one of the most gratifying things sitting here, right, is just seeing the conversations that started then that felt powerful, but we weren't sure where this was all going. And then seeing all of you sitting here today has just been like a really wonderful full circle. And so I would say that the work that really, or the passion behind the work is really having that impact, taking what we hear from stakeholder engagement, from community engagement, from our community partners, and then at the state, how do we transform that into meaningful changes for people so that they can live their full lives in California with the dignity they deserve. So it's just really exciting to be here to talk to all of you today and to be here with the three of you.
Awesome. Thank you, Claire. Okay, so the name of this panel is Home and Community-Based Living, which is a huge topic. And so, Sarah, what time is it? 2:37. Okay, we have 18 minutes. 5 minutes each. If you could talk just a little bit about what resources your agency or department has that is helping us move the dial in this space, helping people with disabilities, helping our aging population be able to remain in their home, remain in their community. Are there any specific initiatives that you'd love to talk about? Bonus points, if it includes like potential funding that our stakeholders out there might be able to take advantage of?
Sure. And I'm going to squeeze in 3 initiatives I'm really excited about. Okay, I could do it. One on caregiver career pathways, one on older workers and employment, and one on people with disabilities and their employment. So first in care, I don't think I have to tell anybody in this room that we have a crisis in care. We have an aging society, the work is extremely challenging, largely unsupported, and we have really an unprecedented direct care workforce shortage in our country. In California alone, we're facing a shortage of direct care workers between 600,000 and over 3 million by 2030. And the caregiver workforce itself is made up of a cluster of occupations with different training pathways, different credentialing, and it's kind of dizzying for people who are trying to really build their careers as caregivers. And there is a huge equity issue at play here. Direct caregivers in workers in California are overwhelmingly women of color. A large number are immigrants, and about half are older workers themselves. So we have serious equity issues to address. To start moving the needle in this direction, the Labor Agency's been really excited to work with CDA on Master Plan on Aging Goal number 4, caregiving that works. And we were selected as one of 14 states to participate in a direct care workforce peer learning collaborative under the auspices of the Federal Administration for Community Living. And we are working together with a team from the Department of Aging, Cal HHS, CDA, the Center for Healthcare Strategies, to work with other states to learn from their experience and create a strategy for California that has a more rational crosswalk around regulatory and statutory requirements around direct care licensure, around a core set of, a finite set of core competencies, a consistent set of core competencies across professions so that we can standardize skills and training and facilitate mobility between and among direct care roles. This will not completely solve the problem of making care jobs quality jobs or ensuring an ample workforce for ourselves and our families, but creating clearer and more accessible career pathways will help. I would say watch for the release coming in the next couple of weeks that will be coming from the California Workforce Development Board, focused more broadly on healthcare, but for high road training partnerships in healthcare. You can see me for more information. You can sign up for the Employment Development Department's workforce information notices where this funding will be released. Really briefly, I want to tell you about a couple of other initiatives. One in early planning stages is to really understand what's going on with older workers in our state. We know that over 1/3 of adults are 55 and older. We know that older workers are found throughout our labor force, and a few trends. We know that they experience longer periods. When they're unemployed, they tend to be unemployed for longer, and they tend to face tremendous age discrimination going back to work. And they tend to be in debt as they age. About a quarter of the 55-plus population has debt averaging over $20,000, and that debt is driving older workers back into the workforce at a time when age discrimination and even the technology of finding jobs right now can be mystifying for people for whom the last time they looked for work might have been the days when they actually got a newspaper and found want ads. And so the Labor Agency is working closely with the Department of Aging and AARP to really start understanding the experiences of older workers in the labor market and to figure out better strategies and evidence-based strategies and to test some pilot programs so that we can do a better job supporting those older workers who want to be and have to be in the workforce so that they are doing jobs that are meaningful to them and help support a standard of living that they need and want. And then just really quickly, we are in a very exciting planning process with our very close partners at the Department of Rehabilitation. I think coming out of our joint dissatisfaction of how people with disabilities of all ages are faring in the workforce. I mean, just the highest levels of unemployment. And are working together to really take a hard look at our public workforce system, which has not done the job that it needs to be doing to ensure that people with disabilities have access, have quality services, coordinated services, and access to jobs that will also be meaningful and lead to self-sufficiency. And so we're leveraging the core competencies of the two agencies really at the local level so that the local workforce boards, the AJCCs, American Jobs Centers are working more closely, more strategically with the local Department of Rehab offices in much more coordinated case management. We don't want a consumer to have to tell the same story, 3 different places to 3 different professionals. Let them coordinate together with a focus on public sector employment. We have such huge hiring and replacement needs in the public sector, especially with an aging population of workers in the public sector, in state service, in local government. And so let's put together that labor market demand with a labor pool of people who can fill those jobs and get the kind of stable jobs in public service that carry retirement benefits, health benefits, and really make this a win for the populations in our communities with disabilities. So about to put out funding that will be targeted towards the workforce boards to select a set of about a dozen in the state, along with an intermediary partner to really have a research lens to understand best practices, test them, evaluate them, and then take them to greater scale.
Awesome.
Did I do it?
Yes, you
Okay.
did. Thank you. And you got the bonus points. Talked about the funding. Awesome. Director Landsberg, we'll hand it over to you. What are the resources that your department is putting in to California to help ensure that folks can stay at home and in their community as they age or with a disability?
Yeah, so we know that California has a healthcare workforce crisis, and so HCI is the department within the Health and Human Services agency that's focused on building the healthcare workforce that we know that we need. We have 3 main goals. One is to help develop a healthcare workforce in medically underserved areas. Many of those are rural, but some of them are urban, and so we have the data, and we're trying to really focus on those areas. Second is to make sure we're helping develop a healthcare workforce specifically to serve Medi-Cal members. And then to increase the racial and linguistic diversity of the healthcare workforce. Again, we know that leads to better health outcomes and also better economic mobility for our California residents. So we have programs to bring people into the healthcare workforce. We're never going to achieve any of those goals without the pipeline programs from high schools all the way up. Also, we talk a lot about the healthcare workforce ladder, right? So someone may come in as a peer support specialist. They may want to get to a social worker. We have certified nursing assistants who want to become LVNs, licensed vocational nurses or RNs. So we're trying to be very intentional about thinking about opportunities for people to move up that healthcare workforce ladder and provide stipends and training programs along the way for people who want to advance in their career. We also, so we're supporting the individuals and also supporting the institutions. And then we focus specifically on primary care, nursing, behavioral health, and oral health care, all of which we know are important to older adults and older Californians. So we've had a couple of programs, to answer Darcy's specific question, we have had a couple of programs of late focused on home and community-based services. So we know that, it's wonderful to hear Secretary Becerra talk about how he was able to keep his mother at home, that family provided a lot of care, and that they needed some other help in addition. So we've had programs to help train certified nursing assistants, home health aides. That's a newer area for us. He asked us to be creative in using our Medicaid dollars, and so we've been happy to use those Medicaid dollars to help folks who want to stay in their home and in community with services. I really want to focus on behavioral health, and we had a great conversation with folks at CDA a couple of weeks ago about the specific behavioral health needs of older adults, and that there is an epidemic of loneliness, of isolation, as well as depression and other behavioral health conditions. So we're going to have a really important and wonderful opportunity in California to invest very significantly in our behavioral health workforce. So under, Darcy mentioned this, the Behavioral Health Services Act, Prop 1, hopefully a Medicaid waiver that's in the works. We are going to have significant funding for the behavioral health workforce. So we have been working with stakeholders to build a supply and demand model on the nursing side and also on the behavioral health side, and accompanying strategies to help us identify where the funding and supports are most needed. So we try to be very data-driven in our work, and we have very significant data through this supply and demand modeling to identify, do we need more social workers in the Imperial Valley? Do we need more psychiatric mental health nurse practitioners or other prescribing providers up in the rural north? So to be very targeted in our approach and really to hear from all of you. So we have put out a behavioral health workforce strategy for review and consideration. It is available on our website, and there will be significant opportunities coming in the next couple of years for significant behavioral health workforce funding. So our website is hchi.ca.gov, hcai.ca.gov. Please sign up for our informational notices about our workforce grants. We have everything from loan repayment and scholarship programs for nurses, behavioral health folks. With the budget cuts last year, we have not been able to do as much on the nursing side as we had hoped to, but we will have significant funding for the behavioral health side, and we're really excited about that. We're going to be starting extensive stakeholder engagement at the beginning of next year to get your feedback and plan out the framework for how to best use these behavioral health dollars, working with all of our state partners up here with the California Department of Aging, and really to figure out how to best build that behavioral health workforce that's culturally and linguistically competent to serve the needs. And I see 5 minutes is up, and those are Claire's 5 minutes. The last thing I'm going to mention is Darcy mentioned the California Healthcare Workforce Education and Training Council. We have a workforce council at HCI, which is really focused on developing a statewide strategic approach to California's healthcare workforce needs. So Abby Snay serves on it. We have folks from the community colleges, the UCs, the CSUs. If it's another stakeholder engagement opportunity for you. We have a meeting the day before the election, November 4th. We always, it's a public meeting. We'll be continuing to talk about our behavioral health workforce strategy, so that's one of many ways to get involved and give us your input about how we can best serve your needs. Claire.
Awesome. Thank you. Please make Director Landsberg your new BFF. She has lines out the door, not to, we're not pitting kids against older adults, but she's got lines out the door of people who are advocating for children and youth dollars, which is fabulous. I've got 2 of my own, but also you all need to be at her door stressing the importance of older adult behavioral health needs. Mm-hmm. And when that funding comes out, really hope that your stakeholder voice is a loud one. Okay, Claire, resources from your
Yes,
department.
and I will start by saying, because the Department of Social Services does a lot of work, but we don't maybe have as many direct resources for like community-based organizations directly, because a lot of our money flows through the counties. So I'm going to answer that question a little bit broadly and talk about some of the initiatives we're working on that you may have actually heard mentioned multiple times today, but talk a little bit about how we're really trying to both, obviously we have the dollars invested in those programs, but how we're trying to make them even more than more than the sum of their parts, and how do we do those connections. First, I want to talk a little bit about our housing programs. The Department of Social Services has 3 housing programs particularly focused on older adults and people with disabilities. That's the Home Safe program that you may have heard of, that's connected to Adult Protective Services. Our Housing and Disability Advocacy program, which is really a combination of housing supports with benefits advocacy, so that people will have the long-term ongoing income they need to support their housing after they have gone through this program. And then our Community Care Expansion program, which is new for the department, where we're actually doing 2 things. We're working to expand, and I want to say that we have a wonderful dashboard that will show you how we have now funded more than 3,100 beds and units that are going to serve low-income older adults and people with disabilities who are on SSI or on our state equivalent, which is called CAPI. And so we're really trying to say with these programs, right, older adults have unique needs around housing and homelessness, and how do we target our programs to the most vulnerable older adults who are both at risk or actually experiencing homelessness. And so we have a lot of potential in those programs to do a lot of good, but also we are not, as you heard today, the only department invested in housing and homelessness. So one of the big things we're really working on to make our own resources go further and to basically connect in with our partners who have access to different resources is how do we work across departments and across agencies to really further leverage what's available. So for example, we are working closely with Department of Healthcare Services, right? They're running forward with all the amazing opportunities that Medicaid is giving them, as Secretary Becerra talked about, to ensure that there are Medicaid benefits, Medi-Cal benefits associated with housing supports. But we know that those are going to do a huge amount for people, and they can't do everything. So then how do our CDSS programs come in and provide complementary support, additional support, maybe short-term support versus medium-length support? And then how do we connect in with our partners at Business Consumer Services and Housing Agency, at Housing and Community Development Department, to say, how do we connect our older adults who may be benefiting from our CDSS programs? How do we connect them into long-term subsidies or vouchers so that they have the housing stability they need going forward? So for us, some of this leveraging is about taking what we've received through the budget and resources we have available, but then looking out at our partners and seeing how we can all become more than the sum of our parts. I also want to mention, as part of my work, I oversee our community care licensing division. And one thing I want to make clear is we license a lot of housing for older adults and people with disabilities. And sometimes people don't realize licensed facilities are homes for people. They are not institutions. So we have many people who are using that kind of community care model as their long-term living situation. So one of the things we want to make sure is that we have modernized our regulations to serve people. And one of the biggest efforts we've made over the last few years, and was in partnership with many people in this room and many people potentially online, is to update our dementia regulations for community care licensing. So this has been more than 5 years in the making, and we are on the verge of being able to promulgate those regulations. They are with the Office of Administrative Law right now, and if they are approved, they will be effective January 1st, 2025. And there's a number of significant changes in these regulations, and we are going to be working in partnership just the way we did in developing the regulations, in implementing the regulations. Because I want to really stress that these are the kind of rules that are going to take time and energy and thoughtful work to implement well. And so as I keep thinking back to what Secretary Becerra said about implementation, right? You can pass the Affordable Care Act, and that is amazing, but then there is work and it tends to be sort of non-stop ongoing work to make sure that the things you pass actually have the effect you want them to have. And so you pass the bill, and then all the work you put in, so you have 47 million people on health insurance, right? So our dementia care regulations will allow us to really create a more person-centered environment, to make sure that people are living in the least restrictive environment possible, and to make sure that people are being treated with dignity, and that we are not using a diagnosis when we need to be looking at functional needs and meeting people where they're at. So those are just two examples. I saw my time also is up. There's more if we have time, but I think we don't have time. So I'll talk to you all later.
We've got a coffee break where you can come ask questions. Just thank you all so much for your time. Thank you for all the hard work as you stakeholders are engaging in on a daily basis. And Director DeMorris, we'll hand it over to you.
Thank you all. Thank you, Darcy, Abby, Elizabeth, and Claire. Thank you so much. And your teams that support the great work that you shared with us today. We now have, are you feeling the push-pull today that it's part celebration for all that we've done together, and it's a long road ahead, so because there's much more to be done. But for our break, we're going to celebrate with cupcakes, all of those milestones that we mentioned, the 50th anniversary of CDA and the Commission on Aging, the 40th anniversary of the Caregiver Resource Centers, and the 25th anniversary of the Olmstead decision. So we're going to take a 20-minute break out in the lobby, and then we'll see you back here for the final 2 rounds of subcommittee recommendations and a legislative panel.